now accepting 3-year-olds into the program. I've shared, my own story with my 3 children going through pre-K and how much of a struggle it was sometimes to have them all 3 in, but it's paid off exponentially in their education. So I'd love to eventually see all 2- and 3-year-olds, San Antonio children in pre-K, so we have a goal. But this is a big step forward. And I think you mentioned that, did I hear you say 70% of San Antonio children are enrolled in some pre-K program?
70% of eligible 4-year-olds, this was prior to the pandemic, and so the children that are eligible are based on those TEA criteria, primarily based on income, but it can be children in the foster care system, multilingual learners, children who are homeless. There's 6 criteria. So of those who are eligible for free public pre-K, 70% were enrolled in a public program.
So do we have any idea how many pre-K aged children in San Antonio are not enrolled in a program?
We have some numbers from 2017 that said about 6,000. Now those are dated, clearly, because we've had the census that has come out and said we have a lot more children in San Antonio, so we are updating that. We do know that infants and toddlers are the place where children are least likely to be enrolled in high-quality early learning, but even our 3-year-olds, very small percentage of them are enrolled in what are accredited, accredited centers that are in quality rating systems.
Is there any effort to coordinate with other pre-K programs to help fill that gap?
Absolutely. So last legislative session, pre-K partnerships were authorized, which means that school districts can partner with high-quality child development centers to provide pre-K 3 and 4, but the child development centers have to meet certain criteria. So we are working, part of our method in working with child development centers is to make sure that those centers can meet those standards so that if a school district is interested in expanding to 3-year-olds, for example, because they don't have the space, they could partner with a child development center to do that.
And we got an email today about announcing the 3-year-olds being able to be accepted into the program. What other kind of outreach are we doing into the community?
So we already, our teams are already outreach and engagement events. We had a big resource fair this past Saturday? Yes, talking about it. And then we'll be out in the community at different, some of your events or council events, but also school events, letting people know. Through our social media, actually, we have a very strong following that we are able to get the word out. But we also, I know I've spoken with some of you about even going out and doing some block walking in particular areas, doing some what we call cultural liaison outreach, where people we know in the community that have tremendous influence, visiting with them to help us spread the word.
Thank you. Pre-K for SA has been, I think, a groundbreaking model for other cities also to ensure that our youngest citizens get the education they need and deserve. The mayor mentioned I think that education is the way to get us out of the generational poverty. I think it's the main way. And not that my opinion matters or studies, right? But I do believe that it's the main way to help really our city to grow and really develop our workforce and want our children to stay here in San Antonio and contribute to our community. I look forward to working with you on increasing the number of children that are able to participate in Pre-K for SA or other Pre-K programs, and as well as ensuring all our children are in some type of health insurance. We talked a little bit about that and how we can maybe go through the Pre-K system to figure out ways to engage families to understand how they can get their children enrolled in healthcare. And finally, I just want to thank you for this morning. We unveiled a mural at Pre-K for SA West, and it was really beautiful, and so I'm grateful to have been there this morning. Thank you.
Thank you, Councilmember Cabello Havrda.